How would you like better engagement with your patients? What route would you use to do that? And could a podcast actually help you engage with your patient population a lot easier? Well, in this episode, we're going to talk to Geoff and Sam, who've been doing exactly that. They created their own podcast, they share it with their patients, and they're going to talk about how they set it up, how it's worked for them, and why they want to keep doing it as well. So join us as we talk about Penny's Hill podcast in our episode today and learn from them how easy it can actually be, and stick around for a free offer from myself as well. So, hope you find this useful. Leave us a like if it is, and let's tech enhance your primary care and learning. So, GP learners, I'm joined here today by Geoff and Sam, who are talking about their podcast. How are we doing there, gentlemen?
Yeah, not too bad, thank you. How are you?
Not too bad, thanks. So I'm awful at introducing people because I always make mistakes and stuff. So how about I let you guys introduce yourselves and what you guys have been up to?
Hi, I'm Dr. Geoff Hamp. I'm a GP partner at Penny Hill Practice in Ferndown. And yeah, we started our podcast back in March, April, May last year as a result of lockdown. And now Sam and I are co-producers and co-podcasters at our increasingly busy podcast.
Hi, I'm Sam McGinley. I'm also a GP at a practice in Ferndown. Again, co-partner with Geoff, and we decided to do this podcast when we felt we wanted to find a different way of reaching out to people, and have found it has grown and grown. We've been really enjoying it.
And I must admit, I've enjoyed listening to the episodes as well. I know you guys did some really fun stuff over Christmas about quizzes, and obviously there's the clinical topics that you're covering for your patients as well. But I guess where I'd love to start is what kind of made you come up with the idea of doing a podcast for your patients? Because that's a little bit unusual.
I think how it started was 11 months ago when COVID started, and we suddenly realised that we weren't going to be able to see people. We weren't going to be able to see the numbers of patients we normally see. We thought, well, it'd be nice to keep in touch with people and be able to provide them with health advice one way or another. And there are a lot of common themes. And so we thought, well, how do we do that? And we originally came up with the idea of a YouTube channel. And we were going to have our physiotherapists helping, and we had plans to be in our waiting room and record our physio doing chair exercises. And then Sam and I realized that would involve us having to be videoed every week, and not being super media stars. We thought, maybe there's another way of doing it. And Sam had been a guest on a different podcast, so we thought, well, maybe this is the way forward. And I think we just sort of ran with that, didn't we, Sam? And it sort of took off from there. I don't think it was a decision just to try and keep in touch with people and our patients and whoever wanted to listen, their carers, their family members, anywhere really. And we were thinking, well, maybe a few patients might have a listen every so often, and it's a way of getting information out to them. We could tailor it that way. It's another resource, but it's sort of turned into the thing that it is now.
Yeah. And it's definitely matured since then. So when we were recording this episode, you're now, I believe, on episode 46 and churning out one a week at the moment, which is awesome. So, I mean, how have you kind of figured out what kind of topics to cover? What kind of areas that people would be keen to know about?
Yeah, I think we started by just thinking what might be cropping up in the midst of lockdown, what common themes might there be out there, but also we had a conversation about common topics that we felt people found difficult talking about to their GP maybe, or that it felt people had sort of not necessarily were lacking in knowledge, but could maybe have done with a bit more information so that they felt less anxious about approaching their GP about that topic. And then really since then it's been in relation to things that have happened during the year, hasn't it, Geoff? So, for example, we involved Live Well Dorset, our public health funded program, looking at exercise, smoking, alcohol intake, that sort of thing, and that was related to just looking at healthy habits in terms of COVID risk reduction as much as anything else. So it's in terms of topics, it's really grown and it's been sort of feeling our way through the year. Yeah.
I think there's been a few we've sort of wanted to do as a result of things as well. So we had I think we knew we had to increase our quaff uptake for things like cervical screening and bowel screening, those local initiatives, and we thought, well, a really good way of getting it out to people is actually, look, we can do a podcast, we can come up with the information, and then even if we get to the stage where we need to run a search that says, actually, look, this number of people haven't had their cervical screening, we can just send them out a link via AccuRx or via the inbuilt text messaging service and say, just please have a listen to this. So some of it was that, but the other thing we also did was we looked at health awareness weeks, and NHS employers actually do have a very good web page that have all the upcoming health awareness things. And for 2021, it's a little bit more broken apart because a lot of people don't know when things are going to run this year. But we tried as best we could to sometimes coincide our topics with whatever week was coming up. So we did miss a few, and some were a bit sort of more by luck, but we tried our best to sort of say, well, actually, for instance, we just had Alison from Stars Dorset, and that's happened to coincide with sexual awareness and sexual trauma week quite nicely. So that ran quite nicely together.
I can definitely see how that works. I mean, I'm assuming there's been a few episodes that have probably been quite a big uptake. I'm guessing things like the COVID ones towards the start and stuff definitely would have been, priority episodes for many patients to understand, I guess, the changes you guys have had to make in practice and that kind of stuff. Have you found that useful?
I think so. Some of the big ones, I mean, we had a really big one when we were reopening the waiting room. So we've remained like you have. We've remained open, but at the height of things, the waiting room doors were closed. And when we sort of reopened with full infection control measures in, that was probably one of the best episodes we ever had to say we're reopening. And sort of reassure them has been quite helpful and really reassuring for them, but also good feedback for us as well.
I was just going to say, I think it's people have just enjoyed sort of hearing our voices, because I think people think, oh, well, everyone's locked down, and even the GPs have locked down, I can't talk to a GP, but to be able to hear us and just to push out little messages about the updates, opening a waiting room, or this is when you can book your flu jab, I think it has just been a reassurance for our patients. Yeah.
And I guess a lot of people sometimes think that creating a podcast is, you have to be super techy and it's really difficult to do. How have you found that kind of more logistical journey of doing the recordings, particularly obviously during a time where we've had COVID, to be honest?
You probably are talking to the two top techie doctors, aren't you? I think in the practice we're both quite sadly techie, unfortunately.
We like tech. We like tech. Yeah.
We could just talk about tech, but nobody wants to listen. I mean, I don't know what you think, Sam, but I think the main thing is being sort of time, isn't it? And it's because a lot of ours are scripted, and certainly in the first year were scripted. So it's the time scripting it and then recording it and then editing it. But I think that's all to do with maturing the podcast, and you get used to it. It becomes a bit of a routine, and then sort of getting it out there as well. What do you think, Sam?
Yeah, I mean, I think in terms of actually practically achieving it, I think firstly, we get on well. We work pretty much the same days of the week. We found that we have a good day of the week that we can both record, and it's been fairly easy in terms of finding that part of it. It's been more because we aimed to do one a week. It's just been making sure we keep our topics going and keep that flowing with script or no script and that sort of thing. That's probably been the bigger challenge, hasn't it? But other than that, I think it's been quite a smooth ride, hasn't it?
I think so. And from a sort of a tech point of view, which kind of works for us is, although Sam says we're in the same days, pretty much most of the week. I mean, we've got shared sort of Google Drives with, documents, and we've got Google Sheets. So we've got all of our podcasts on there, so what our ideas we've got and sort of the dates, so we can keep an eye on things and when we've got recording sessions. So we are able to communicate with each other, sort of even when we're not able to talk to each other. So that works quite well as well, I think.
Mm-hmm. And have you found the benefit, I guess, of having an accountability partner in a sense? So obviously, there's the two of you doing it together, kind of that whole concept of showing up because the other person's kind of doing the same. I know when me and Andy were doing this, we kind of stuttered partway through after our first year because we both got really busy with PCNs and things. But actually, it was the fact that we were both trying to support each other with doing it that actually got us through. And then as a result of that, we found that actually that's the thing that helps us. But I wondered if it was the same for you two.
Yeah, I think we've kept a fairly open, guess, flow of conversations. We've not got a topic for next week. Okay, let's have a quick look at the list. Okay, I'll get something ready for that. So I think we've kind of worked well together. I've definitely handed over all of the editing and all of that to Geoff because he loves it. Slightly more than me. And he seems to be happy doing that. So I'm happy with that.
I think it is. I imagine it would be harder if you were trying to do it on your own. It's that having the ability to sit down and go, yeah, okay, right, I've got to do that this week. And yeah, as you say, if you've got someone else you're working with, then you're going to go, okay, well, I've got to do it because we've got to go live. And that's why we wanted to do weeklies as well on a Monday, purely because it kind of, I suppose it puts us in a routine and it means that there is something to work to. We know we've got to do it. It did get to the stage at the end of last year where we actually had several weeks recorded ahead, which was lovely, but then
I was just going to
very
say,
difficult to go back to recording weekly podcasts again.
Yeah.
And we've also found this year that we even if we are recording slightly ahead, we're now trying to record the beginning and end, the top and tail sections a bit more closer to the time, because we were finding last year that we'd had a lovely intro recorded all about some aspect of lockdown, and then there would be an announcement 3 days before the podcast goes live, and our podcast was completely wrong then. We'd said, stay indoors, and Boris Johnson said go outside. And
True. And I guess how have you found that engagement with patients? I mean, particularly with finding topics and stuff. I know you guys do something interesting with trying to get that information as to what topics your patients are wanting to hear. Can you talk to us about that?
we say there's different ways people can get in touch with us. Our IT department at the CCG were very, very helpful, because we said, look, we're doing this and we don't really want to give out our own email addresses. We don't want to come to the general practice email address because it's just going to get lost. So we said, please, could you set us up a podcast email address just specifically? And they sort of said, oh, we'll have to look at it, and then turned around and said, yeah, okay, that's fine. So that was quite helpful, because we can say, here is our email address. We put a contact form on the website, which we can also include in our emails when we send out every Monday if we need to. So when we had the coronavirus immunization FAQ podcast, we actually sent out an email with the form embedded in it, so people could just reply from their email. And then we very bravely went live on Twitter a couple of weeks ago. We've got 10 followers, so we're doing really well. We're quite at the top of Twitter now, and so people can contact us that way. But I mean, saying that, Sam and I have both had conversations with patients who've said, "Oh, by the way, we listened to your podcast, and could you put this in?" I've got a letter on my desk today from a patient who wrote in saying, "Please, could you put this on your podcast?" So we're happy for people to ask us to do anything, or have guests on, or whoever. We can't promise we'll do it, but we'll try our very best.
Sam, how have you found, I guess, that contact with patients who have listened to your podcast and they talk about it? How does that feel, and how do you deal with it as well? Because it must be interesting.
Yeah, well, firstly, it's just fascinating to hear that they've listened. And actually, I find that the people that are listening are usually the patients I'm talking to more regularly anyway. They tend to have more chronic health conditions and be in that sort of cohort that seem to be engaging with this sort of material. So it's led to interesting conversations about future topics, and it's I think mostly they're just intrigued that we're finding different ways of communicating back out to the general public. I think the only worry has been when people suggest topics that are either quite complicated or about quite unusual conditions, and sort of dealing with an explanation that we may cover that at some point, but there's probably other things that we need to deal with first, and just helping them to realise that there's probably other priorities. But yeah, it's been good.
I know you mentioned the email, so has that been a great way of trying to share the podcast with patients? Because I guess, particularly if you're working in a more elderly population, it may be somewhat a little trickier to get them to know how to access things, whereas I'm assuming email's less of a challenge for them.
Yeah, it is. I think it came out as almost a byproduct, because we also went live with a new website, completely unrelated, which I sort of do quite a lot of I've got a lot of the admin rights to it. So what we ended up doing was posting weekly updates on the news page to say, well, have a listen to this podcast, and that email gets sent out to anybody subscribed. And because we embed the podcast into the email, a lot of our patients, especially the more elderly patients, listen to it that way, because if you said listen to us on iTunes or Spotify or Google Podcasts, I don't think they'd be able to do that. And that's always something we've thought, Sam, isn't it? Actually, how do we try and promote it?
Yeah.
Or how do you make it more accessible to some of our more elderly patients? Because it's very easy for us, isn't it?
I think I'd say I've learned not to assume people cannot access it. Actually, people are more tech savvy than you allow for. It's and it's fairly simple to access, isn't it? Certainly now it's embedded. I think it's, yeah.
And that's why we put it on the website as well. There's a dedicated page on our website where, if you can access the website, you can do an e-consult, you can listen to our podcasts.
So have you got plans for broadcasting it in the waiting room then?
I'm not sure we'll approve the license.
We made a decision years ago when we put a TV in the waiting room that we wouldn't have sound on, because a lot of patients found it really distracting even just to have visual things on the TV. So I don't know. We could. I don't know. We see what the partners think. But I don't know how we would do that. We just have a dumb TV sitting up there that runs a PowerPoint presentation on loop.
It's a very intriguing question. I hadn't thought about that.
I guess it's a great way of sharing potentially the voices of the practice with the patients. The main downside might be the fact that patients may want to listen to the podcast and not see you, and then that's a bit of a problem, I guess. But hey, a nice problem to have.
Or they'll come in and say, "But you just said this on the podcast outside, and now you're saying it's completely different."
And I guess with that, how much traction have you seen with the podcast? Is that something that you feel you can share with us? Because I know there's probably a few GPs or other practices out there thinking, actually, we might be interested in doing something similar. Is it, how beneficial is it? How effective can it be?
We've seen growth, definitely. And Geoff hopefully will give us some figures or a kind of a idea of where our traction's been, but I think certainly I recall back in kind of May time when we were looking almost every day going, oh look, we've got 2 more listens, and now we're kind of up to tens if not 100 a week on average or something like that. So I think we are in a place where we are seeing traction. Wouldn't you agree, Geoff?
Yeah, definitely. It was, and it's very cliched, but as we said earlier, we sort of, when we started, we thought, oh, well, if a couple of people listen, we'd be more than happy, and that's as far as it'll go. And in the early days, we were very excited, to get a new listen, and we were, I think, didn't we have bets around Christmas, Sam, as to when we might reach 1,000 listens?
Yeah.
I seem to remember. So we're approaching 3,000 listens now, and I think looking at our figures over the last week, actually, we've had 107 plays. And 130 something plays. So we are. I mean, we did have some very big spikes in September, October when we went live with our health, alcohol, stopping drinking, stopping smoking podcast. But we had I think a much bigger audience from our public health team then as well. But Yeah, 100
I
or
mean,
so a week.
we're a practice of 8,000 patients, so I don't, we're quite a small,
Mm-hmm.
relatively small practice, and I consider that the vast majority of people knowing about us will begin with being a patient here, whether or not
Mm-hmm.
that then gets fed elsewhere via social media or whatever. But I think for our size practice, I'm quite happy already with those numbers if we consider
Mm-hmm.
the demographic we serve as well. So yeah.
We do
Yeah,
get notifications of sort of when we have people from other countries. So although we don't have massive numbers of listeners, we actually do have, just on our Spotify data alone, we have almost 30% of listeners in the United States, which is
mm-hmm.
it's either real or it's an IP based thing. But I mean, we've got sort of countries in Australia and Belgium and Switzerland, and okay, they're not maybe regular listeners, but we do know we are reaching people out there, which is
Mm-hmm.
nice to know.
And although not another country, you do have one in Nottingham that likes to listen to the podcast and also sharing it. So I know one of the things I'm setting up is that actually to share your podcast with my patients, because a lot of the topics and stuff are quite useful. And I think having that content to share with patients in terms of particularly the clinical topic based stuff, because I appreciate some of the stuff is clearly going to be focused around your practice and your area, which is, I think for individual areas, if they're interested in doing this, a really positive idea, because it can help share those, those care pathways, those navigations, that kind of stuff with your patients, and a referenceable data, like a library of data that you can share, just like we would with a patient information leaflet, I guess. Hey, GP learners, quick little interruption here. If you do want to start creating your own podcast for your practice, I'm running a free webinar that you can join. Links are down below in the show notes. Have a quick look, sign up, and join me as I talk you through the free ways that you can set up a podcast. Let's get back to the podcast, shall we? But if there were practices out there thinking, well, actually, we might want to start doing this, I guess what would be your top 3 kind of tips for them to say, this is what you need to think about, this is what you need to kind of know if you did want to start doing this for your patients and things?
I think have a clear idea in mind of what you want your podcast to be achieving. So if it's just if it's clear, simple messages about common daily things going on, or if it's about particular medical topics that you find are more common around in your area. So having a clear idea about your topics, and that'd be my first one. Yep.
I would say, and actually some very good feedback I had from, as you said, at Christmas we had some slightly more fun podcasts, and we did have Father Christmas on as a guest, which was very nice.
Awesome. How did you manage that?
Why did you not hear this, Candy? Yeah, so our Christmas Eve episode. Yeah, our Christmas Eve episode went live at 9 a.m. on Christmas Eve, and our special guest was Father Christmas, who was flying from the North Pole, heading over towards New Zealand to start. But one of not to ruin the illusion, but one of Father Christmas's admin assistants, maybe let's call him, who assisted us with Father Christmas. He has his own podcast. He's actually a radio presenter in Scotland. And he said, because he had a listen, he said, one of the best things to say is, don't worry about feedback. And I would say this to anybody, because you kind of, it does get a bit, not depressing, but you get to say, well, actually, is anybody listening? Is anybody finding this useful?
Mm-hmm.
Because you say, well, please give us feedback and please give us likes, and a bit like everything, you don't hear anything back. You think, well, maybe this isn't working.
Mm-hmm.
And his advice was actually, people won't give you that positive feedback. Some will, but the majority of people won't. And it's only when you stop doing it that they turn around and go, oh, actually, do you know what? We really missed that. So
Mm-hmm.
it can be a bit disheartening to think, well, you're just talking and nobody's listening and nobody really cares. And it's just you two sitting in a room amusing yourselves. But actually, there are people listening, and they are people actually really finding it useful. And so I'd say anybody who's going to do it, yeah, definitely, take heart. You are doing a good service, definitely.
Cool. And have you got one more tip for us then?
I think
Make sure you get on well.
Yeah, Yeah, but that's general practice.
Yeah.
I think the other thing I'd say as well is it doesn't have to cost you anything. I mean, our podcast is hosted for free. Um, we don't have advertising. We've chosen not to be sponsored. We're not interested in that approach. We kind of want to be independent and free to say what we want to say, rather than this podcast is now sponsored by X, Y, or Z. So it doesn't cost anything financially. It doesn't have to, but it does cost time. But actually, I don't know, Sam. It's been quite nice to take a bit of time out and not sort of to do something a little bit different. It's a bit of it keeps you a bit sane almost. I don't know if you find that as well, Gandhi. It's a different part of your day job, and it's not sitting there forever on the phone and doing paperwork in e-consults and path links.
Absolutely. I mean, I must admit, this kind of the content creation side of it that I've been doing for the past few years, it ticks off a different part of my brain that just keeps me engaged and also drives a lot of the passion, because for this one, for the EGP learning kind of content that I create, it's finding out new ways of doing things and helping other people, and that just drives me to want to still do general practice as well in some way, because I need to be doing that in order to find out all those different ways. So it helps in that aspect, and then learning all the stories that you come across and the journeys that other people have gone through. Yeah, it just keeps me going. The trick is not falling down the rabbit hole, as I like to call it, and then going so deep down that you're like, okay, I'm now doing too much of it, shall we say. So I guess my tip for if people did want to do this kind of stuff is just make sure you've got a little bit of time carved out, that's when you're going to kind of do this content creation, because trying to do it on top of all your other hats regularly is something that's going to become really difficult to maintain. Whereas if you've got a little bit of set, and it doesn't have to be a huge amount of time, but a little bit of time that's just set aside for doing it, it just makes it a lot more fun and a lot less stress, I find.
And talking about rabbit holes, if you are particularly techie, then it soon does become quite a tech rabbit hole of yes, being very excited by buying lots of new kit.
Yes.
It doesn't have to, but if you're techie, then it can do very quickly.
Absolutely agree with you there. I have lost track of probably the amount of money I spent on kit to do the podcasting and the vlogging. But again, you're right. You don't have to. Just to get started, to be honest, most people, you can do it with either a smartphone or a laptop, and that's all you need, to be honest.
Yep.
And you get cracking. Thank you, gentlemen. I've really enjoyed this. I've really found it useful. And like I said, I love the podcast itself. I've been sharing it on our practice pages and stuff, because I think some of the content has been really useful. I really enjoyed your recent one on Raynaud's, actually. So sharing that with patients that I'd actually had. I was trying to find a good resource, and I was like, actually, this one I've listened to recently. Here you go.
Well, that's good to know.
So that was a nice little explanation and stuff. And I think that's, like I said, that's the benefit. It's finding that referenceable piece of information that you're happy to trust and share with patients to help them understand some of the challenges that they face, and being able to have that, I find really useful. And I'm hoping a lot of people listening to this will also do so. If people did want to get in contact with you to find out more about what you've been doing, I guess I'm thinking other colleagues in the profession and stuff, are you happy for that to happen?
Absolutely.
Yeah, definitely. Yeah.
Cool. So if you are watching this, let us know. You can see the email address. I'll put it down in the show notes and things for everyone to have a look at. And thank you for joining us.
Thank you.
I hope everyone's enjoyed this episode, and let us know down below what you do think in the comments. As Geoff mentioned, we don't often get loads of feedback, but any feedback is always appreciated. And definitely, if you found this useful, leave us a like down below. And as always, EGP Learning is here to help save you and your patients' time by taking hands in primary care and learning. Catch you in the next episode.